This is our general machine that we're going to be using in class, and some of your athletic training rooms are going to have them. When you get to this screen, notice it has electrotherapy, ultrasound combo. We're not going to worry about these over here, and we're not going to worry about any of this other stuff for right now. Because we're in electrotherapy, we're going to start off with interferential. So you're going to hit electrotherapy, and notice it brings you right to interferential. When you come here, this already has everything already pre-set up, which is great, except for you need to know your patient and what you're trying to do with and for your patient. So sometimes this doesn't work perfect. So to change things, what you're going to do is look at customize. Before I get to that though, notice right here are blue and green leads that are actually already hooked up to Meredith. The blue and green, and it should say 1 and 2 right here. If you have 3 and 4 hooked up to your patient, but this says 1 and 2, you are not treating your patient, you're treating some invisible force over here. So always make sure that if it says 1 and 2, you're using the first and second leads, and also that you just didn't pull it out of the thing when you do that too. They need to be good and plugged in. So to customize, you would come here, and then notice you can change everything. Meredith currently has, and the squares and the rounds don't matter as much, but she has the big rectangle. So we want to make sure it's on square. The next thing that we're going to look at is cycle time. Usually for interferential, we don't change that, so we leave it for off. Carrier frequency, remember we can go between 4,000 and 5,000. And as we increase them, notice they basically go up by 500. So we're going to put her in the middle at 4,500. And then we can do sweep on or off as we're going through these. And we can have off meaning it's going to be fixed, or on meaning that it's going to start rotating through areas. And as we do that, we can have an 80 to 150 as we look at the low and high beats. But it doesn't just have to be 80 to 150. We can increase this all the way up to, say, 100. And leave the high beat at 150, we can change whatever we want to do with this. But when we talk about our pulse rate, that's really what we're talking about, is this is what we're changing here as we're doing this. So it doesn't have to be 80 to 150. It can be anything in the middle here. And really you're thinking about how new her injury is and how sore she is and everything else as you're carrying these. For vector scan, the automatic is auto 40%, but oftentimes I change it to the 100%, meaning that it's going to 100% of what we want. And then once you think you have everything set up and it's on your patient, then what you do is you're going to slowly, and again, same instructions as TENS, it needs to be a nice tingle, not anything else crazy. And actually, I'm going to take this for Meredith, who's been filming for me, so you can actually see how this is set up on her leg. It's the exact same thing as the TENS. Notice the blue is this way, and the green, moving all over. The green is the crosswise. The blue is the vertical, so we hook it up the exact same as we did it before. Your patient should be in a nice relaxed position. Notice here she is sitting and just all kinds of relaxed, and I'm going to give that back to Meredith. And so then what we do then is once we have everything set, then we slowly start to, and actually I say slowly, but in the bottom you can turn it up a little bit faster, and again tell them once you start feeling something, I need you to tell me, and then you're going to go a little bit slower. Tell me when you feel it.
Okay, I'm starting to feel it.
Okay, and then we go a little bit slower, and then she again is going to tell us when she gets that real strong buzz.
Right about there.
Okay, so everything's set. If we need to, we can change the time because she's not really going to do it. We're just going to leave it here. And then you come down here and you hit the start button. It says it's setting up the treatment. And boom, now it's going. And notice our intensity is starting to roll through. It has the first and the second leads going. We have our treatment time, so it shows us how long it's going through. And then this gives us right here all of our information as we're going through their particular treatment. Same as for the TENS. If every 5-ish minutes you want to come talk to them, and then you can just start turning up the intensity a little bit again as she's going through it, because again, she's going to accommodate for it. Once she's done, or say it's really hurting or you ran out of time, if you need to change something, you can hit pause and change stuff, or at the end of their treatment, you just hit stop and it comes here. Don't really worry about doing any of this kind of stuff. For at least in class, we're just gonna clear this treatment and it brings us back to the main page.